Okay, everyone. It's my pleasure now to introduce our next speaker, Dr. Augusta Williams, 2019 graduate from here and has been working a lot in the climate and health space back since we were students here together. We'd really, in the interest of time, encourage you to check out Dr. Williams' bio in the program, the complete bio. And for now, we'll mention that Dr. Williams is an assistant professor of public health and preventive medicine at SUNY Upstate Medical University. So over to you, Dr. Williams. And afterwards, we'll reconvene upstairs.
Thank you. Thank you. Hello, everyone, and good afternoon. Can everyone hear me okay? Great, thank you. So my name is Augusta Williams, and I graduated from Harvard Chan in 2019.
Excuse me.
I promise I'll be quick, and then it's time for a break, I think. But hello, everyone. I'm a member of the Harvard Chan class of 2019, and it's been great to be back this weekend, seeing old friends, connecting with new, and being back here in a room of public health experts, but also enthusiasts around a topic I've been extremely passionate about for a long time, and that's climate change and health. And specifically for the next short bit here, going to hopefully bring a lot of the different pieces we've been hearing about this weekend together to talk about how the climate crisis is a health and healthcare crisis, with a specific look at how we can use health to motivate some of these solutions we've been talking about and to advance health equity. So when we think about climate change, as we've heard about today, we think about hotter summers, worsening drought, rising tides, more frequent storms, heavier rainfall, more appearances in some places of that infamous polar vortex, more rampant wildfires, worsened air quality. And these are, of course, the symptoms of the climate crisis, powered by the burning of fossil fuels and emissions of greenhouse gases like carbon dioxide and methane in our atmosphere, blanketing the planet and warming it. And as we've heard here today, and hopefully you all agree that climate change is real, it's happening now, and without drastic cuts to these greenhouse gas emissions that are warming our planet, these risks will continue to increase. The 5th National Climate Assessment, released last year, describes how every bit of additional warming will lead to greater risks to our infrastructure, ecosystems, economies, well-being, but also our health. In fact, the Lancet Countdown on Climate and Health has deemed climate change to be the biggest public health threat of the 21st century. I think we've heard a lot of discussion, especially this afternoon, that points to how this is the public health topic we need to be talking about. And as the climate around us changes, we will see more children with asthma, increased incidence of acute and chronic health conditions that impact the cardiovascular, renal, respiratory, reproductive health systems, threats to maternal and child health, worsened mental health outcomes, longer allergy and tick seasons, and most unfortunately, we will see more death. This is why I've believed for a long time that the climate crisis is a health crisis, and perhaps what has brought all of you here this weekend. Those who will be most harmed by the climate crisis are those whose voices have historically and systemically gone unspoken and unheard. It will be children, the elderly, people with limited economic means, those with pre-existing health conditions or disabilities, and communities living as fence-line communities, continually exposed to toxic-filled air pollutants and the risk of exposure to hazardous chemicals, who will be hurt first and worse by the climate crisis. But I strongly believe that public health has a huge role to play in leading the way at tackling all of this. Picture this. A 35-year-old male patient presents himself at an emergency room in late April. He's a construction worker and just started a new minimum wage job this week, a week that happens to coincide with the region's first few warm days. He's found himself really tired, he has a headache, but he can't sleep. At times when he's been at work climbing a ladder, he's found himself extremely dizzy, afraid he's going to fall. He had COVID-19 last year and has had bouts of shortness of breath since then, but this week in particular, it seems to be extra bad, even when he's just doing basic tasks. Even though his new insurance hasn't kicked in yet, he hopes the doctor can help him. Being new to work, he doesn't have any paid sick time, but he also can't miss work in the morning, but he also can't afford to get hurt at work this week. Those working outdoors or indoors, as we've heard in the last little bit, are making up a disproportionate number of workplace heat-related injuries. For farmers, farm workers, forestry, fishing, hunting, workers, that risk can be up to 35 times greater than in other industries. And these folks are having to work in continually hotter conditions. From locally to globally and across all at-risk industries, we currently lack adequate protections, like Barack has talked about. Protections that would prevent the thermal decompensation this patient is currently experiencing. And it will be the immigrants, migrant workers, low-wage workers, workers with limited English proficiency in this country who lack the adequate protection to speak out against these types of work practices. They may fear retaliation from their boss of speaking out, or even retaliation to just go get a drink of water when these protections are not in place. But they also may lack paid sick leave. They may lack a livable wage. They may lack health insurance. Things that are all seemingly important when we look at this single scenario through more of a climate lens. And all of this is public health. Another scenario, you're a home health nurse and just arrived at your elderly patient's home. Yet again, another bad storm has rolled through earlier in the week. So it's been a few days since you've been able to make it here because roads were closed, power lines were down. And you find your patient without power. He's one of the over 3 million Medicare beneficiaries who relies on electricity to power a medical device. Electricity he doesn't have at the moment. A heat wave is starting, and between his lack of power, a non-functioning air conditioner, limited shade outside of his house, and other factors, you're worried about him. You know he's at risk of heat illness due to his advanced age, limited mobility, pre-existing health conditions, so you plan to check in on him tomorrow, even on your day off. By mid-century, the number of older adults in this country is expected to grow to be about 1/4 of our US population. We think a lot about aging in place, but to do so in a climate-changed world, we'll need to ensure that people have adequate and sustained transportation to care. Climate adaptation solutions like cooling centers, but also resources to weatherize, cool, power a home will be essential. And this is important in urban areas, but also, and perhaps at times more so, in rural areas or in communities where folks may be more socially isolated. Or perhaps you're a parent visiting your urban pediatrician's office. Your daughter has had asthma her whole life, but this week there's been recurring wildfire smoke, and you've noticed that it's gotten so much worse. It's also been hot out, so you've noticed even indoors, your multifamily high-rise building where rent keeps going up, it's become harder and harder to pay to use electricity or to power that air conditioner. The air pollution inside and the heat inside is worse than you remember. You want to be able to take your daughter outside to play, be a kid, be with her friends, get exercise. But between the wildfire smoke and the heat, it's too much to walk to the nearest nice park 20 minutes away. There's a park that's a lot closer, but it has no shade, and it only has metal playground equipment. You're hoping to find some ways and some tips from the doctor about things you can do to bring relief to your child so that she can breathe easier and stay cool and keep being a kid. Scientists have estimated that children born in 2020 will experience 2 to 7 times more severe weather-related events than their grandparents. As we heard a little bit about in the last panel, children have disproportionately higher rates of consumption of food, water, air, more rapid growth and development, immature metabolisms, and very long future lives that are important to think about. And because of this, due to their greater exposure, they're also more at risk of experiencing the health impacts that accompany these same weather events. Or imagine you're the chief of a local fire department. You and your crew have been working around the clock, it seems, this summer, and you're actually down quite a few staff members. Even though you haven't been being called to active fires, a lot of your team members have been experiencing heat stress this summer. You've been being called to more hospital transfers, overexertion outside, traffic accidents, behavioral assists, and you've started to wonder if your department can withstand hotter summers with the staff, the personnel, and the budgetary resources you currently have. You've spoken to your colleagues in EMS and police and public safety, and they said they feel the same. You speak about this with the health department as to why you might be facing such extra strain this summer, and you end up seeing that your city might be one that's been examined to show increased risk of dispatching of emergency services on hot days. Depending on which city analyzed, your fire department services may be increased 6 to 18%. For police, while wide range, this could increase from as little as 3% to 57%. But even the smallest percentage here over many days can add up quickly. These are all also symptoms of the climate crisis and examples of how these compound and cascading effects will accompany the changes we've already set into motion. Perhaps sometimes hearing about these types of scenarios leads you feeling overwhelmed, confused, anxious. I can attest to all three depending on the day, but it's important to reframe. As these climate and health crises are unfolding around us, we need to think about how health can help, how health can lead the way to motivate and inspire action. Health professionals are routinely identified as some of the most trusted messengers in our society. For a long time, public health has been that dependable, trusted messenger for health messages that can lead to fostering individual and collective action. While this notion has faced threats, especially since the start of the COVID-19 pandemic, the repercussions of which we are still grappling with as a field, framing climate-related conversations around health can make these conversations and provide actions that seem more tangible and salient. A message about wanting your child to breathe cleaner, healthier air is much more approachable to a patient or a community member than talking about the specifics of a cap and trade policy or divestment strategies. Public health is the well-equipped person at the table to lead the way on this. As health professionals, we can educate people to recognize the increasing number of climate-related threats and susceptibilities in patients and community members and colleagues. Information on communities' health assets or their underlying vulnerabilities, but also existing or the potential for new resources that exist, can help improve our preparedness. They can inform solutions that allow us to mitigate the very worst of the health outcomes from occurring. We can talk about this in everyday conversation, but also with people in positions of influence, like the media, as well as with people in positions of decision-making authority, like policymakers. We can make the case for how the climate crisis is presenting in our community, if that's in the emergency room, in a health clinic, but also in affordable housing developments, in schools, in workplaces, wherever you may be at this table. And these are acts of advocacy that can shed light on conversations that could otherwise go unspoken, shed light on health inequities that may otherwise not be named, and bring about more equitable solutions than may otherwise be present in that conversation. We're also powerful conveners. I know I've heard a bit about this weekend. We are often the connector. We bridge gaps in programming, communication, and strategy to identify who should be at the table, but more importantly, bringing more chairs and making the table bigger and listening to who is at the table as we go. Climate solutions will require this. This sometimes seems like an innovative concept to people when I'm in conversations about climate change, But if we think about it, these are the core tenets of the field of public health. In addition to working within the context of businesses, workplaces, policies, the government, clinics, all of which we've heard about here today, we also need to work with and within our local health systems to help mitigate the worst of the climate crisis. In the US, the healthcare sector is responsible for about 5% of our nation's greenhouse gases. That's an estimate that at times actually places healthcare greater than the aviation industry in this country. When looking globally, if the healthcare sector were a country, it would be the 5th largest emitter of climate warming greenhouse gas emissions on the planet. And when we continue down a path of releasing more and more greenhouse gases, the health sector continues to contribute to climate change. From a system based upon the principle of doing no harm, continued contributions to the climate crisis will perpetuate a system where those unspoken and unheard voices will disproportionately be harmed by these damages. By focusing on sustainability in health systems and in healthcare, we can mitigate these organizations from continuing to be major contributors to climate change. We've seen some valiant strides in this in recent years, and a lot of great efforts have been led or born out of individuals who have come out of or currently work here at Harvard-Chan. But there's still a long road ahead, whether that's in healthcare, in government, in education, in our homes and business. But despite that, we know we have ways to fix this. Again, something we heard echoed multiple times today. We have so many solutions at our disposal to leverage health to mitigate climate change and adapt to the changes that have been set in motion. We can make better, more sustainable, and health-informed decisions today. This could be things like minimizing waste from supplies, from devices, from food, services, travel. We can think about who has the power in a community to leverage economies of scale. In my community, health systems, government entities, and a few large business corporations hold that power. When they work together, they can be the ones to encourage local investments in things like improved public transportation, improved walkability of our neighborhoods, investments in carbon sinks like trees and parks and more resilient infrastructure. We can improve energy efficiency, transitioning to cleaner sources of fuel more quickly and cleaner sources of transportation. We've seen the cost of renewables and renewable forms of energy drastically decrease in the last decade. This has largely been due to both technological advancements, but also prioritization of this in economic and political decision-making. This has helped spur the rapid growth and adoption of these tools across the nation. But at the same time, the American Society of Civil Engineers recently gave the US energy system a C- as our grade. You can look across multiple references, whether it's the US Government Accountability Office, Swiss Re, other large insurers, the Department of Energy. They all project that climate change and continued strain on our grid will threaten our nation's energy resilience, from energy generation, transmission, distribution, and demand. We are starting to see in recent years real historical investments in our electricity grid infrastructure. And this also has the power of increasing community resilience before, during, and after severe weather events. But integrating health into these conversations can accelerate the pace at which we're moving. Research, including some work out of this institution, shows that increasing renewables and energy efficiency reduces greenhouse gas emissions, reduces air pollutants related to those fossil fuels, and that improves health. One study has showed by implementing 3,000 more megawatts of wind across all of the Midwest states can yield over $2 trillion in climate and health benefits. And in many regions of the US, the health benefits are just as large, if not larger, than the climate benefits. Making these investments at home also yields health benefits. Things like improving energy efficiency, heat resilience, which could mean, using a lighter, more reflective material on your roof, planting some more shade trees, using better insulation in your home, better insulated windows, has similar benefits. A study that looked at single-family homes in 10 cities across the US found that these types of retrofits to existing homes can yield $1 to $1.5 billion in direct utility savings to the occupant, but there's another 44% of benefit, roughly $629 million, when we also look at the climate and health benefits of this equation. When climate and health savings are included, the payback period of these investments also decreases by nearly half. And not factored into these estimates is the health benefits that come with making your home more energy resilient, more resilient to the conditions outside. And that's especially true if these investments are made in housing and in neighborhoods that serve low-income, disadvantaged communities. And we can apply these same tools to the health sector. Work currently under review estimates that if one moderately sized New York academic medical institution were to be 25% more energy efficient and adopt 100% renewable energy, estimates that this institution is actively trying to meet, the actions of that institution could yield $850,000 to $1.5 million in added health benefits to the local and regional area. By conservatively extrapolating some of these measures to the 200 plus hospitals across New York State, where I'm from, there's somewhere between another $100 to $200 million in health benefits on the table that aren't being factored into these equations. For institutions that are grappling with the economic decisions and implementation of these large-scale climate solutions, these estimates and talking about health can tip the scale. And when you're specifically thinking about the health system, talking about the social good that this is also doing to improve the air quality and children having access to clean air that helps them breathe better, as institutions dedicated to not doing harm, this is a powerful message. And this is well supported in other literature as well. Even though qualitative and quantitative health benefits are not often included in climate action plans, analyses of global climate policies have found that factoring other benefits, especially health, has a critical role in determining optimal decarbonization rates. Because these benefits, again, especially health, are often large, they occur quickly in time related to the time of implementation of project, and they have a great added value, especially in disadvantaged and developing communities, which means these are also powerful tools in conversations to advance health equity. The 2024 Climate Resiliency Report has recently updated the estimates of the economics of climate resilience. They found that for each dollar invested in climate resilience, there are $13 in benefits from avoided economic costs in communities, from avoided damage accrued from extreme events, cleanup, recovery efforts. These estimates include things like avoided lost work and income following something like a hurricane, saved industrial and agricultural production from storms, or damages to infrastructure. But in reading this report, do you know what's not factored in? Health. Or how the estimated savings from lost work and maintained income, or keeping your home or your business, your livelihood intact, still having access to viable, affordable sources of food and water, benefits communities. It benefits individuals, especially when those communities may be disadvantaged, or it's kids or workers, older adults, communities of color, people with limited income. Climate change is a health threat multiplier, but investments in resilience and preparedness, whether that's by communities, by the health system, by businesses, by governments, can help us achieve a world of greater health equity. So let's see these things as an opportunity for healthy solutions. By integrating and inserting health, maybe sometimes that's inserting ourselves into these conversations, policies, or decisions, these types of tools have the potential to prioritize health in our communities. They can promote better patient and community care, and make the health system in our world and all of these other related sectors more resilient to climate impacts. Many climate mitigation and adaptation decisions will also immediately make our air cleaner, make our neighborhoods more resilient, and better promote the health of our friends, families, and neighbors. And that is a public health win-win in my eyes. So in order to confront climate change in a way that really protects public health, we need all hands on deck. We might have to bring those hands to the deck and put them together sometimes. But we need intersectional and multidisciplinary solutions because there is much to be done, but also a lot to be undone. Everyone has a role to play, and I truly see public health and the many health disciplines with which we regularly work as leaders in the mission to reframe these conversations, to think of these health crises as an opportunity for a better, healthier, and more equitable world. Thank you. If people have them and we have time.
Please join me in thanking Dr. Williams again for the very inspiring talk. Dr. Williams kindly said there might be time for a question or two if somebody has a quick one. 1 minute, one question in the back.
Yes, Dr. Williams, thank you so much for your lecture. It really resonates in my own experience. My name is Roy Golda, and I work as a medical director for a group of doctors in Puerto Rico and San Juan. One of the main things we do in our program is we help the elderly by going to their homes and providing medical care, especially to those that are bedridden, that have chronic conditions like Alzheimer's, Parkinson, amputations or like for diabetes complications, etc. And now with climate change, we are seeing that our work is even harder because we are seeing other things to the climate change that we didn't used to see before, such as dehydration that has already been mentioned, and even fungal infections, which is something we're seeing, because humidity and heat equals breeding ground for fungal infections. And they're getting very difficult to treat. And then we have, as everybody knows, the storms, tropical storms, et cetera, that bring enormous problems as well. And one of the main problems that we're having right now is that with the floods come, after the storm is gone, there are a lot of puddles and water that is a breeding ground for mosquitoes. So now we have an epidemic of dengue fever caused by this increased water that's breeding ground for mosquitoes. So I relate very much with your lecture, and I hope I can contribute in any way in the future. Thank you.
Thank you. Yeah, I think thinking of those multiple intersecting events, I know a similar concern in my own community. We've had a lot of recurrent flooding and rainfall events, and that leads to mold exposures and more breeding grounds for different vectors like mosquitoes. So it's also interconnected, as we've heard about today. So I think that's really important. Thank you.
Any other questions? Thank you very much, Augusta. So it is 3:30. One of the things that we have heard from our alumni was that Alumni Weekend, there's not a lot of chance to talk about what you've heard and sort of what happens next. And there's a lot of sort of debrief that I think our alums have talked about. So if you participated in Alumni Day, Harvard has Alumni Day now, and we did something in May at Alumni Day where we had a knowledge cafe where they had a topic and they talked in groups and they had discussions and they sort of talked about it and they just brainstormed. I don't want to use that word, but they really had a good discussion. And we want to do the same thing today. So, but here's what the process is. So we're going to go upstairs and you can grab a snack, some coffee, whatnot on your way. I think it's right outside here in the G level. And then go back to the cafeteria, just grab a seat. We're going to talk for about a half hour maybe, and we're going to and we have some facilitators who are going to ask you all to really talk about what happened this weekend. What did you hear? What are you going to do? what your individuals, what your organizations are going to do. And then after that, you're going to move to the atrium, which is right next to it, for some champagne and some dessert. So, thank you very much. So head out upstairs, grab some coffee.